Fire and rescue services are coming across more and more cases of hoarding. Up to 1.2 million people in the UK may suffer because of an over-cluttered house. The Safe and Well visits made by Northamptonshire Fire and Rescue Service look to help residents at home in order to prevent fires and improve their well-being. Marverine Cole reports.
Morning, Mr. Horsley. Kevin from the Fire Service. So come to do your Safe and Well visit.
Morning.
Kevin's visit isn't just about fire safety. It's designed to help keep Mr. Horsley safe from other accidents and includes advice about avoiding falls and reducing clutter in his home.
You don't leave them close to anything that's flammable or leave them there, because you can actually get a hoard of flammable material on your actual fire escape, which is your staircase.
At any one time, we're probably processing around 100 visits. And I would say about a fifth of those are related to clutter or levels of hoarding. And those referrals come in from lots of different partners, or from people themselves or concerned family members. We work with a whole host of agencies across the county, so the statutory agencies like our police colleagues, colleagues in adult social care and children's services, but also smaller charities as well. So charities like Home Start, who work with vulnerable families, and also Age UK for older people.
An extreme case of hoarding in Merseyside last year. The elderly couple living here kept so many possessions they were trapped and died inside. The sheer volume of clutter prevented firefighters from accessing the property. Safe and Well visits mean the job of the fire service is no longer solely about responding to a fire. Taking a community approach has led to a huge reduction in the number of deaths and injuries from fire.
It's about improving the health and well-being of the people of Northamptonshire, ensuring they can live in their own homes for longer, and keeping them out of the statutory health and social care sector. If we can avoid an older person having a fall, for example, they're not going into hospital, they may not need social care after that. And so there's also an economic argument for the things that we're doing.
More examples of recent high-risk hoarding cases in the county. Sometimes traumatic events can upset the balance of life, as was the situation earlier this year for this mother of two who didn't want to be identified.
Everything just got on top of me. I wasn't well, I was in hospital and I was really poorly. It took quite a long while to get over everything, and then I had to move and I didn't have much notice when I was moving. And then on top of all of that, my grandmother died, and a lot of her stuff had to come with me when I moved to my new property, to my new house.
After a referral by social services, a trained officer paid her several visits.
I found an extension lead buried in the kitchen, plugged into the wall, and I followed the lead, and it went up and over the top of the fridge and down the side, and then there was another lead plugged into that, which came across the kitchen door, down to the end of the kitchen, and I found the reel, which was still rolled up, which we encourage people to pull everything out, under a pile of bedding, plugged in with a freezer as well. That's where a fire could have started so easily.
Jo worked with the local council and they fitted extra sockets. And she persuaded the mum to gradually clear the clutter. Oftentimes, careful negotiation is crucial.
It's very difficult because their perception of hoarding is perhaps not what our perception is. And it's actually trying to build that rapport, trying to encourage them, and not try to make too much of a point that they have got a problem. It's all about how we can try and adapt their ways and make it a safer environment for them all to live in.
On a personal perspective, I joined the fire service to save lives. It doesn't matter to me whether we save a life through medical intervention, through putting out a fire, or from preventing someone having a fire in the first place. I mean, ultimately, that's what it's all about for us.